In this segment I'm going to demonstrate the Mediroyal NRX Ulnar Deviation Splint. Now, ulnar deviation of the MCP joints is common in clients with rheumatoid arthritis or other inflammatory conditions. During periods of inflammation, what happens is the supporting structures around the joint become overstretched. So as a result, pinch and grip forces gradually push the joints ulnarward. In advanced cases, the extensor hood, actually the extensor mechanism, slips off the MCP joints into an ulnar deviation position, pulling those MCP joints further into ulnar drift. The joint itself might actually end up subluxing too. So that then limits both flexion and extension and thus creates a problem with functional grip. So the NRX Ulnar Deviation Splint is designed as a volar platform with a malleable metal core that's then encapsulated in this NRX material. The metal core can be adjusted and shaped to provide stability to the MCP joints and to support that palmar arch. And the splint holds the MCP joints in a neutral position during activity to prevent further deviating forces. It can also be used as a resting hand splint or overnight to reduce the pain and deforming forces during sleep. And in neuro clients, the splint can also be used to separate fingers. So for example, in stroke patients who have problems with palm hygiene, or it can be used to protect that palm area from pressure. And because this NRX material is Velcro hook receptive, that piece can actually be added to a basic resting splint. Also, this NRX material provides good pressure relief and it doesn't absorb moisture, so it can easily be washed. And it can be used during ADLs, even in water, because it dries very quickly.